Hello everyone, I'm Dr. Luis Velez, a nephrologist here at South Texas Renal Care Group. Welcome to our offices. While you're waiting, I'd like to talk to you about blood sugar and diabetes. So I'm going to tell you about where blood sugar comes from. I'm going to tell you about how it's regulated. I'm going to tell you about diabetes, and we're going to talk about complications of diabetes as the last part. So let's get started. Blood sugar, also known as glucose, is the preferential fuel for the cells in our body. The food that we eat is absorbed and released into the bloodstream as blood sugar. Blood sugar can also come from our liver in between meals when we have not eaten. These two processes work together under the guidance of the brain and maintain normal blood sugar levels. Now that we know where it comes from, let's talk about how we utilize it and how it's regulated. Insulin is produced by an organ called the pancreas. Insulin facilitates the entry of blood sugar from the circulation into our cells so they can utilize it as fuel. Think of insulin as the spout on a gas can, or possibly a funnel that allows you to take the gas from the gas can, pour it into the gas tank, and allow the engine to run. Without the spout and without the funnel, that engine will never run. So insulin serves the same purpose in our bodies. That is, it allows entry of sugar into the cells so that the cells can function normally. Now that we've talked about where sugar comes from, how it's regulated, let's talk about what happens when this interaction between our brain and our pancreas doesn't work properly. When this interaction breaks down, we have what is called diabetes. Diabetes can be broken down into two separate forms, type 1 and type 2. Patients with type 1 diabetes have insufficient amounts of insulin to respond to the needs of the body. That is, there has been damage to the cells in the pancreas that produce insulin, so it cannot meet the demands of metabolism. These patients are usually diagnosed early in life and require insulin from the time of diagnosis. Patients with type 2 diabetes do not have a lack of insulin necessarily, but there is a resistance to the insulin that is produced. That is, the pancreas cannot keep up with the demands of the body because the insulin that it is producing is not as effective. This insulin resistance is mediated by fat tissue. The more fat tissue the patient has, the more resistance they develop. Patients with type 2 diabetes are generally diagnosed later in life and are initially treated with medical management or pills when they are diagnosed. However, as their resistance increases, they may progress to requiring insulin therapy later in the disease process. Now that we've talked about where blood sugar comes from, we've talked about how it's regulated, and we've talked about the breakdown causing diabetes, let's talk about the complications of diabetes. Our bodies are not designed to run on high blood sugar. Long-term exposure to elevated blood sugar levels causes changes in our bodies, particularly in our nerves and our blood vessels. These changes usually take 10 to 15 years or more to occur. That is, 10 to 15 years of uncontrolled diabetes. The organs that are most affected are our eyes, our heart, the brain, the extremities, and the kidneys. So patients that have long-term uncontrolled diabetes can develop visual loss and blindness. They can develop premature heart attacks and strokes. They can develop tingling, pain, and numbness in the lower extremities. They can develop ulcers, wounds, infections, and amputations, and kidney disease, and ultimately dialysis. So if you have diabetes and you have any of these complications, please see your doctor so they can help you manage your blood sugar and get you referred to the proper specialist. If you have diabetes and kidney disease, then you've come to the right place. Here at South Texas Renal Care Group, your kidneys are our passion. Thank you for listening.